Hey everybody, I'm John.
Hey guys, it's Andrew.
We're here together to kind of go over some things in the special order that came out. I know there's a lot of things are happening fast and things are kind of scary, and there's so much information that's flowing out there right now. We wanted to make sure that all of our valued career and volunteer EMS clinicians, firefighters, and other public safety personnel all have the most recent information and all are on the same page. So we make sure that at the end of the day, everyone's informed. You can make the best decisions possible out there in the field, and you go home safe and well. I think that's pretty much our goal.
Yeah, definitely.
All right, so I'll dive into it, Andrew. You answer where you can, and I'll try and pick up where I need to. And there's a lot of information. This is the third iteration of our special order. I know I've been driving you crazy because I'm like, hey man, I know you just signed this one, but it's outdated already, so can you sign this other one?
Got to keep up with the changes.
All right. I think one of the concerns that are coming up is PPE. So I'll let you tackle that a little bit. Some people are they're like, do we have enough PPE? Are we going to run out of PPE? Why does Andrew keep asking me what PPE I need? How do I get PPE? So I'll let you...
Well, I think the first important thing to remember is that we do have PPE. We're not out. There's rumors going around that we're running very low. I mean, while we do have to watch what we're using, in the same sense, we do have PPE. So I know there was a lot of confusion amongst the providers regarding the methods and the routes of how to go about getting PPE. So to clarify, the email that I sent out a couple weeks ago asking all the chief officers to give us your wish list, essentially, was for exactly that. You were trying to figure out what you were going to need in the future, kind of your best guess of what you thought you were going to need in the coming weeks and months ahead. Not so much what you currently had on stock. So the list that was submitted, and by the way, that list was submitted. It's running through the state. From what I've heard, they've gotten these supplies. They're currently inventorying them, and then they're going to be passing them down through the counties and everything. So that stuff is still coming. But then there was a lot of confusion with the 213 forms that came out going through the logistics side. Mm-hmm. That's for your critical needs. So if there is anything, masks, gowns, gloves, anything like that you need, routine stuff, not anything out of the
Is toilet paper on the list?
No, toilet paper's not on the list.
I know bleach was on the list.
They could probably find it. But, that kind of stuff, you fill out that ICS 213 form, email it to the logistics side, and Nick's doing a pretty good job, as far as I know, getting everything out. And last I've heard, all the requests have been filled in a timely manner. So, I think that's the important drive home with that, is that we do have some available. If you get to critical levels or you're starting to see yourself getting low, fill out the 213 form, send it through the channels, and it will get addressed, and Nick will fill your order, and somebody will bring it to you to the firehouse or EMS station.
Yeah, and I think that's really good advice. I also would like to add in that one of my things that I've seen is for the longest time, and I think that's one of the reasons why we're here together, is it used to be us versus them and career versus volunteer. And I think that this particular pandemic really breaks those barriers down. And I just want to remind everyone that the PPE that we have is not for us, it's not for them, it's for all of us. Mm-hmm. It's so we all go home, we all have families, and we all want you to go home to your families and not bring anything home to them. So whatever is being delivered to the stations, it's being delivered for everybody, mm-hmm. for everyone to share. And if you run out, you got to let us know, and we'll deliver more to you.
Yep.
And that's the thing I wanted to make sure that
Absolutely.
we bring home. So there were some questions. There's some confusion out there. That I think there's some rumors that are going about that we only had enough PPE where we have to start reusing it, and deconning the masks and stuff. So I think you already touched on that. We have an ample amount of PPE. Don't be wasteful about it, but we're good for now. Should they be reusing their masks and gloves and gowns?
I mean, there is some stuff floating around about reusing, but our setting is different. So for routine wear, if you're going around wearing your mask and you're just totally doing it preventive, I would say yes, you probably could reuse those masks. But when you're getting into patient care of any kind or any interaction where you're dealing with a suspected person of interest, if you will, no, under no circumstances should you be reusing that. There's no effective cleaning method that we know of that will reuse those masks. You should deal with that call and immediately dispose of it when it's done.
So if I'm going to the grocery store looking for toilet paper, and I'm that person with the mask on, or if I'm sitting in the station and I'm using the mask, that's good. I can wear that in for the entire
In
day.
a controlled environment of the station, yeah. I mean,
Yeah.
they're rated for up to so many hours. I think it's 8 hours of use or something. So yeah, in that situation. But
Once I have patient contact.
as soon as you're putting yourself into that exposure, immediately throw it away.
I'm glad we're clear on that because there was a lot of crazy rumors
Yeah,
floating
there
around
was.
out there. All right. I think on that topic, I think one of the things that I also, there's a lot of good best practices out there. And one of the best practices I think I came across recently was that to treat this kind of like the same mentality you would treat a hazmat call. And that's time, distance, and shielding. So you want to limit the time that you have close contact with persons of interest. And then you also want to distance yourself, make sure you're practicing good social distances. I think it's 6 feet, like we're 6 feet away, so
Right.
we're good. And then you want to make sure that you have your proper PPE on so that you're not exposing yourself unnecessarily. And I think if you follow those basic principles, you're doing everything you can to protect yourself.
And I think the important thing to remember, I mean, with regard to that is the amount of providers that you're putting into these exposure areas or exposure zones, if you will. And, typical practice has been, we want as many people to ride as we can. And that, at least in this time of crisis, that it's all that's shifting, all that's changing. And it's not that we don't want the people there and volunteering or riding along with the career personnel or whatever, but it's just in this time, it just doesn't make sense. It's not in anybody's best interest. So you really want to try to limit to a driver and your provider. Obviously, there's going to be scenarios where that's not ideal. If you've got a high priority patient or something like that, you're going to have to get a little bit more in depth. But initially, you should be arriving on the scene, sending one person in to figure out what's going on. The rest of your providers stay back. I mean, it's best practice for everybody involved. So
yeah, and I think it really limits the exposure that you're putting your entire crew at risk. And if you, like you said, like have one person go in and be the recon person, and if they need more resources, they can call in more resources.
Exactly,
But,
like you said, tying it back into the hazmat. I mean, it's
Right.
it's exactly like that.
And I think we're not trying to dissuade people from being part of helping out. We're just trying to minimize the risk that our providers have in contacting and having that prolonged exposure with persons of interest that
And I
we
think-
should be protected from.
And with us, I mean, obviously we're held to a different standard, so we should be practicing what we're preaching. I mean, if all the
Yeah.
messages we're putting out are social distancing, limit the amount of people you're interacting with, and then we're showing up with units with 4 and 5 people on it on an
Right.
ambulance and 6, 7 people on an engine, a couple of chiefs' vehicles, whatever else you have,
Yeah.
it just doesn't make sense with the model that's being put into play these days. So
Yeah,
at least for this crisis.
No, and you're right, and that goes along to lift assists, how many people we have on a working code, things that maybe. So we have a working code, whereas before you'd want to intubate somebody or you have someone you want to put on CPAP. If you can do that using the most minimalistic approach possible, then you should do that. You should avoid having nebulizer treatments for patients who can manage treatment without the nebulizer. You should, if you can lift a patient with only 2 people, lift a patient with only 2 people. That way you're not exposing more people than you need to a potentially hazardous patient.
Absolutely.
And by all means, wear your PPE. Please wear your PPE. And I think maybe that kind of dovetails into the last thing. Was on the back of the unit. Why you don't need, if you don't need to take 3 or 4 people in the back of the unit. If you can safely transport a patient with one person in the back of the unit, and the driver can isolate themselves up front and close the door or the window, whatever they have, I think that's also good advice. That's something that we want to promote here, and make sure that we're keeping that minimalistic approach to patient care.
I know there's a lot of questions out about assessments and stuff like that for EMT students, and we're looking into that, so we'll hopefully have some answers on that soon. But if you do have a provider that is riding as a third, I mean, obviously you're going to want to put them up in the front seat with the driver as long as they've had no patient contact, but it really is, like we said, best to just driver and your provider. That's the best route, at least during these times that we're in now.
Yeah. I think that's all the things I wanted to cover on here, other than let everyone know we're all in this together. I know these are scary times, and I know everyone's frightened, and I know you're worried about your safety, but we're all in this together,
We're all just as challenged. We're all working through this together. I mean,
Yeah.
there's stuff where there's unknowns we're facing every day. I mean, this is all uncharted territory for us. So I do want to emphasize, I think everybody to date has done a really good job.
Oh yeah, absolutely.
I mean, I'm hearing nothing but praise of the system as a whole and how we're reacting to this and how everybody's treating it and everything. So I think that's really important to recognize you all for doing everything that you're doing, and we appreciate it.
Yeah, I mean, we have I've heard, and I know it's out there, and there's some EMS clinicians, and both career and volunteer, that said that it's scary and they don't, they're afraid to bring it home to their family. But at the end of the day, people are counting on us, and they're counting on us to be there for them at their most crucial hour, and it's our job to be there when they need us. It's what we all signed up for, and I think we're impassioned to be the people that are there to help, and we're impassioned to be here for our community. And I applaud all of our volunteer and career EMS clinicians, firefighters, public safety dispatchers, law enforcement officers, doctors and nurses who are all out there doing what they do and what they love to do in what could be the greatest battle of our time.
I mean, communications with the gathering of the information beforehand. I mean, it's all one big loop of just continuous effort from everybody. And I think another myth to kind of debunk, and Captain Robbie Jones said it best when we had our last conversation of a meeting after the meeting before the next meeting.
We've been in a lot of meetings, bro.
We have. As long as you are wearing your PPE, I know we've been hitting on PPE a lot throughout this little episode here, but I mean, really that is paramount. If you're in those levels of exposure and you're wearing your proper PPE, you're at almost slim to no chance of
Getting
exposure. And that's the thing to remember. So I understand the fear. You were speaking of the fear of some providers who aren't, they're scared they're going to take it home to their family and all that, and we understand those fears. They're natural, but that's why we're pressing so much about PPE, because it really is your best mechanism to prevent against it. And as long as you follow everything that's been pushed out thus far, I mean, you should be good. That mixed with self-monitoring and
bring a spare change of clothes.
Yep.
I encourage you guys to bring a spare change of clothes. Change at the station. Don't go home in your uniform. That way you're definitely not bringing it home. Other than that, I just want to say thank you to everybody for what you do, what you continue to do. Our peer support team's out there for all of our first responders. So if you just find yourself in need to want to talk to somebody, it's DES peer support at charlescountymd.gov, and they're there in case you need to talk with somebody or you just need to vent, and that's for everybody. So hit them up.
Yep. We'll be doing more of these little episodes, pushing them out, so I feel like this is the best method to get the information out to you guys, so be expecting more. Thank you for joining us.
Thank you.
Until next time.